Obapa Bimah, aka HB, health issues, ekoma yenyina. Yariye, Yariye nyakura. Yariye, nyakura. Enti mini ya shawuye, mini ya bongubai. Shewa pomode so na yari anka wan shedemo. Mini ya shawuye, mini ya bongubai. Shewa pomode.
Good afternoon, ladies and gentlemen. It's yet another Sunday, a beautiful day, a bright Sunday that the Lord has made. So we can all rejoice and be glad because the day has been made for us to meet again, once again, to discuss our usual topic, health issues. Today, my name is Hanna, Bimah, bringing you Diabetes, Diet and Diabetes, which is D&D from Richmond Media to you. This is streaming live on Facebook, YouTube, and you can listen to us also on the radio. What is diabetes? When we look at our current world, diabetes is really taking, if it's not the leading, it might be the second in the world. That's affecting so many people. But how can we manage it? How can we live with it? Because it's a chronic condition. Once you get yourself in it, either it will be managed by medication or diets. So if you haven't gotten it yet, there is still a chance, a way for us to preserve and to prevent ourselves from getting it. How can we prevent ourselves from getting it? This is one of the ways, by creating awareness and then promoting health. How can you create this awareness so that people can hear? This can be done through Richmond Media, the only media bringing you health issues. Continue to stay tuned and listen to us. Whilst you are watching us too, you'll benefit from today's program. Once again, I have with me today no other person than my own brother, Mr. Maxwell, Owusu Ansah. Brother Maxwell, you're welcome to Richmond Media.
Thank you very much. Thank you.
You're welcome.
Thank you.
What do you say to our viewers?
I would first and foremost thank them very much for always tuning in to listen to us, especially in this time, in this current moment we are in, where health has become a very troubling issue. So I would thank them for always tuning in and then listening to us. And I hope whatever we bring out here can be taken in good faith. Yeah.
Thank you so much, our viewers. You are very precious to us this afternoon. So please continue to stay with us until the end of the program. And I'm very sure that you will benefit from today's program. Mr. Owusu Ansah, what I want our viewers to know this afternoon is for them to share. Please don't be selfish. Okay. Let your brother or your sister who doesn't know that this program is also going on know the way so that they can also be able to protect themselves from getting diabetes. Mr. Ansah, what is diabetes at all? Because it's not everyone that is watching us is in the medical field. So if you can explain it so that others will be able to understand what diabetes is.
Okay. Thank you very much. I would say that diabetes, as mentioned, it's a medical condition.
Friends and family, if you are watching us today, this afternoon, we are discussing diabetes, diet and diabetes, which I call it DD. So if you are with us, please stay tuned, continue to be with us. And I know at the end of the program, you will get something from us, you benefit from us. You will enjoy the program so that you can also share with your brother or sister who doesn't know that there is a program that is going on here right from Richmond Media. At this moment, I would like to extend our sincere gratitude to my own boss, the CEO of Richmond Media, who is with us at this moment. Boss Bobby, thank you so much for making this program possible this afternoon. As we keep on waiting for Mr. Owusu Ansah to rejoin us, please continue to stay tuned. And I know today's program you'll benefit from us. We are discussing diabetes. If you don't know what diabetes is, and maybe you might have heard of it, it might be a friend or a family member who might be suffering from diabetes. This program will be able to highlight or to enlighten you about how you can help the person to maintain, or how you can help them to preserve themselves from getting diabetes. However, if they are with it already, they'll be able to live with it without many complications. Mr. Ojansa, please, yeah, let's move on. Thank you.
Okay, so as I was saying, diabetes is a medical condition which is considered a chronic one as such, and then it describes abnormal levels, usually high, uh, abnormally high levels of sugar in the blood of an individual. Um, Whenever we ingest food, um, the very substance that the body takes up and works with, mostly in terms of creating energy for our daily activities, is the glucose that exists in our food. So when it's taken up into the blood, it is worked on by the body and then used in producing energy for our daily activities. But when it gets to a point that there's abnormally high levels of such substance, which is the glucose, the sugar in the blood, and it's measured over a period of time and seen that it exists for such time, one can be diagnosed as having diabetes, which in effect is abnormally high levels of sugar in the blood.
Thank you so much. Please, if you are watching us, there is one thing that I want to emphasize on this afternoon. If you receive the link that will take you to this program on YouTube, please don't click on the arrow on the picture. Don't click on it. Just click on the link, the blue link that will be able to take you to this program. Thank you so much. Mr. Ojansa, how many types of diabetes do we have?
Okay, thanks once again. Okay, thanks once again. I would say that clinically or medically, um, we can talk of three types. Yeah. Um, Type 1, diabetes, type 2, diabetes, and then a third one, which is closely related to pregnancy, that being the gestational diabetes. Type 1 has its form, and type 2 also has its form, but basically their symptoms, their signs and symptoms are the same, to say, in effect. The difference in the types comes about with the work of the pancreas, the human organ or tissue, let me say, uh, known as the pancreas. It produces some hormones that work on the sugar when it's in the blood. So that's where the differentiation is. Um, it comes about with the production of that hormone and then the usage or the proper functioning of that hormone. That's where the distinction is. So type 1 and type 2 all have um, the end result is that there exists problem of the hormone working to achieve its desired effect, which in fact is helping the body to assimilate and then utilize the glucose. So in effect, whenever someone is having diabetes or is diagnosed as having diabetes, what we are trying to say or talk about as happening in the person's body is that when the um, i- when the person eats or ingests anything, that food component, food substance known as glucose, may get into the blood. However, its desired effect cannot be achieved. So the glucose remains in the blood, and then this can cause pretty much uh, lots of problems for the individual if the glucose does not um, achieve what it set out to achieve. Yeah.
Thank you so much for this explanation. So, if I'm what should I say, layman, and I don't know anything about diabetes, and now I'm having some symptoms. How can I know that these symptoms that I'm having is attributed to diabetes or type 1 or type 2? Definitely, we know when you are pregnant, that one identify itself. But for the type 1 and type 2, how can I know the difference without even or have not been seen by a doctor or a specialist?
Okay. So I would say that the determinants of that condition um, has to be a measured, check. So when one gets to the hospital, he's being monitored over a period of time for say about 3 or 4 consecutive times. So whenever we determine that the blood sugar is abnormally high over such a period, maybe over the 3 or 4 consecutive, but with respect to the signs and symptoms, I would say that um, the differentiation is also the way it is being treated. Type 1 diabetics mostly, I would say, would rely on the um, human hormone known as the insulin. Yeah, and then the type 2 people are mostly um, they are cared for or um, we plan medications for them to use. So any individual that experiences any of these signs over a long period of time, say consistently or consecutively, should have to visit the health facility. So you might have um, lack of energy, and then um, you might also have lightheadedness, dizziness, and it can also happen that when you have a cut or maybe a wound, the the time it would take to heal would actually delay as compared to maybe previous instances. So when you see all these, then it behooves on you to visit the health facility to get a proper check to know whether you have this.
Thank you so much, Mr. Ansah. In addition to what you told us about the treatment, what is just to let our listeners also know that, or our viewers know that, not previously, type 2 was only being treated with medications, tablets alone, but now it's not like that. Some of the type 2 diabetes are also being treated, uh, tablets plus insulin altogether. So just for us to take note of that. So depending on the treatment regime or the treatment pathway from your healthcare provider, that will determine on what type of treatment that you will be given and what treatment is appropriate for you as well. Thank you so much, listeners and viewers. Please, as we continue our program, we are bringing you this good news: diet and diabetes, how we can control diabetes, how can we maintain ourselves when we have diabetes, and if we haven't gotten it, how can we prevent ourselves from it. That is the awareness that we are creating at this moment, and we are promoting health so that we can look after ourselves well, know what to eat at the right time, and the amount each, so that we can be free from these type of illnesses. Sometimes though, it's not what you eat or what you drink that brings about it, because there are some ways that it could be hereditary. But when you haven't gotten it, you still have the chance to protect yourself and to prevent yourself from getting it. Thank you so much, Mr. Ansah, for coming back. Also, what are some of the causes that contribute to diabetes? You are muted. Mr. Ansah, thank you so much.
All right. So I had actually wanted to talk more on the signs and symptoms. We have to take particular care. You see, each individual has a pattern he or she follows throughout the day. Let me say there will be a daily routine, but in the course of your work, um, in your daily activities, when you tend to lose energy quickly, as compared to or in comparison with the type of work you are doing, you see that you lack energy um, in frequent times. Say the kind of work you are doing may not demand um, maybe much energy, yet when you see that you get tired easily, alarm, and then you have to visit the clinic. If you lose weight too, like considering yourself and your um, daily living, if you get to know that you are not under any stress or anything of that sort that could make you lose weight, yet you are losing weight, then you have to also take note of that. And then when you get thirsty really easily, yeah, you'd have to also take note of that and then visit the health facility to get checked. Now, if you could please ask the question again.
The causes of diabetes,
Okay,
please.
okay. So I would say that would be related to what I said initially about the differentiation of amongst the types. So it could be genetic, as rightly as discussed last week. There could be a defect in the DNA, that was passed on from a parent to an individual. And so, um, in the body's functioning, whatever happens, that would end in um, having a negative effect on the pancreas of an individual. That could bring about um, diabetes. So I would say genetic factors, and then mostly the lifestyle of the individual too. Most especially in terms of what the person introduces into his system. So, consumption of alcohol excessively could also bring about that. Smoking as well, and then there can be also other underlying conditions. So, just as we discussed last week, if an individual has hypertension or high blood pressure, that could um, be a risk factor or can predispose the individual to this condition too. So um, that's what I can say about that. And then, okay, when one also tends to have weight, um, being overweight, yeah, let me put it that way, being overweight or obesity can also, in turn, cause such a condition.
Thank you so much. You made mention of a mother passing it to the child. So that means you are making it clear that it is a hereditary as well.
Sure. When there's a history of that condition in your family, then you would have to be very mindful of how you live your life. Yes, most especially when it's coming from the parents. When there has been the existence of such a condition uh, in from your parents, yeah, you have to be very mindful because it is a defect, and then it can be passed on. So probably for all you know, it might have been passed on, but then you would have to be very mindful of your way of life. Yeah.
So that means when we go to the GP, to our various doctors, to the house arts, and then they ask, sometimes they do ask these questions consistently that patients don't understand the reason why wherever they go, these questions are being put forward to them. That if there is diabetes in your family, so they mention some kind of conditions. The reason is it can be passed on to the other generation. That's what Mr. Owusu Ansah is telling us. It could be that your mom might not even have it. Your mom or dad might not have inherited it from the parents, but you being the grandchild might get it. So if it's in your family, not only your mother has it, but any member of your family, could be even in the extended family, not just the nuclear family, then you have to watch out. Just look after yourself well, watch what you eat and how you present yourself. Don't forget to exercise as well, as that is also part of it. Thank you so much, Mr. Wusanza. So, what are some of the dangers uh, of diabetes?
Okay, so when it comes to diabetes and then the individual's life, I would say there exists lots of probable detrimental states, health states that the individual can get into. You see, in as much as the blood is the entity that carries the vital forces to enable the body cells to work perfectly. When this condition happens, what also happens is that the state of the blood becomes disturbed. The state of the individual's blood becomes very disturbed. The blood pH changes, and lots of other things follow. So wherever the blood gets to, there is the tendency that such a defect can be also passed to that area. But what mostly affects the individual is that the energy that the individual would need to function properly as an organism, that will be pretty much affected, because the sugar would continue to be in the blood, and then it cannot be used or taken up by the cells and then used for such energy. So the life of the individual becomes really, really affected, because the organism needs that kind of energy to work. So it would rather tend to affect all the other organs, since the required energy for them to function properly wouldn't be there. So that's how it starts. That's how it starts. So it poses a very great danger to mostly all the organs, all the other organs. It poses a really great danger to all the organs, because the energy they would need to work wouldn't be there. The sugar would um, be stagnated in the blood.
Thank you so much for what you have given us. Our viewers and listeners, please, you're watching us from Richmore Media on YouTube and on Facebook, and you are listening to us on the radio, Richmore Media. Continue to stay tuned. Don't forget to subscribe, to share, and to like this program. And don't forget to invite your friend as well to join us this afternoon, as we have good news to you about diabetes, diet and diabetes, which is I am making it as D&D. It's very, very important. So please keep watching us and stay tuned. Thank you so much. Mr. Owusu, so can diabetes be cured totally at all?
Okay, as you mentioned in the beginning, this situation or condition is classified as a chronic condition. So medically, it can be said that it's only managed once you taper into that kind of situation. All you would need to do is to manage the condition. That would mean you'd have to do anything to help keep the sugar level at an optimal, say at a normal range, in order to help the body to function properly. That is medically. But to start with, all that brought about this might have been, if not genetics, it might have been a lifestyle um, defect. So let me use this as an example. So if it was the consumption of alcohol that brought about this, when that lifestyle is changed for the better, the individual can um, live up to task. The human organism can live up to task, because the causative agent has been taken away. However, if it is genetics, then it will also be um, managed as we are talking about. So medically, it is considered chronic, but I can say that with a proper way of living, when all the checks are put in place, and then the individual takes critical look at whatever he gets into his system, then he can live up to task.
Thank you so much. Thank you so much. Sister Tai Muhammad says, lovely topics. Thanks for sharing all your knowledge on these diseases. Thank you so much, Sister Tai, for watching us. Keep watching us and invite friends and family to also come and take part of it, so that they are not, what should I say? So that they will also have their share in this program, so that we don't finish eating the best part of it and then they will say, had I known. But as we always say, had I known is always at last. But it will still not be at last with Richmond Media. We are always available for you, bringing you good news to your doorstep. So please keep watching us. Stay tuned at Richmond Media, Facebook and YouTube, and listen to us on the radio. Thank you so much for listening. What if I can put it that way? How does diet, or what role does diet play in diabetes?
Okay, thank you very much. Um, one very bright health advocate has said, and this has been used over the years. Any individual is what he or she eats. You are what you eat. So I can say, relating to that text, that diet plays a very important role when it comes to managing health conditions, because it is out of the diet that the body can make out the substances it will need to live on, to fight disease conditions. So diet, it cannot be sidelined. It plays a very important role. Even um, in the advent of medication and all that, diet still is taking um, the very important role. So diet really helps. It can determine, it can make or unmake you. Let me put it that way. It can determine how well you will be able to manage your health condition. So in this case, in diabetes, diet plays a very important role.
Thank you so much, Brother Maxwell. And Mr. George Owusu says, interesting. Thanks for the insights. God bless you. Thank you, Brother George, for watching us all the time and contributing to the progress of this program called Health Issues. As you continue to stay tuned, don't forget we are discussing diabetes, diet and diabetes, how to maintain ourselves from getting diabetes. But if we have it in the other hand, how can we maintain ourselves? How can we preserve ourselves? And how can we live a healthy life that will help to sustain our lives and to give us a longer life that we all long to have? Thank you for staying tuned and thank you for watching us on Richmond Media. Right from Richmond Media is coming to your doorsteps. Richmond Media on YouTube, Richmond Media on Facebook, and Richmond Media, you are listening to us on the radio. There is no other station that will bring you this kind of insight into diet and diabetes than the only one and original one, Richmond Media. Maxwell, as we are talking about diet and diabetes, and you've made mention of it, how we can live on diet to maintain our diabetic level. In this case, what are some of the foods that you think can contribute to the maintenance of diabetes or can contribute to prevent us from getting diabetes? Thank you.
Okay, thank you very much. Just as I brought up last week in the discussion of diet and hypertension, I would like to suggest that you see, this is mostly for Bible believing Christians. If you know where you are coming from, like how your substance was made, I believe it will be well to go by the principles attached to that origin. You see, so I would say that the human organism was designed in a way to be able to work on food to get its vital forces to live. Um, Aside the other ones that are not taken into the system, such as air, sunlight, and the others. When it comes to diet, I would say that the best food for man, any human, in relation to health, would be the seeds, the grains, the nuts, the vegetables.
Thank you so much, Mr. Owusu Ansah.
Oh,
As he's mentioning, we have to balance our diet. So we have to get it from all the nutrients from each of them. A bit of each will make us a whole. But yesterday you were talking of plant-based diet. I was in the shopping center and then I bought a plant-based is it milk
okay,
coming from two different fruits.
okay,
And when I tasted it, in fact, I didn't like it. I didn't like it. It's good to have some a bit of sweetness in it, but this one it was like, uh, could I say I was drinking water? But it's a milk. So in this case, when we are taking these plant-based that you are advising us to have, and we are not having any taste from it, how can we maintain ourselves with such foods, please?
okay. Thank you very much for that question. I would say that um, advocating plant-based diets as the best has always been uh, what was originally planned for this human system. However, I would say that rightly, as you said, to balance the um, required or nutrients that we take into our system. I would say
Thank you so much, Maxwell, for your contribution today. Indeed, you are really letting us know where our stance are and how we can control our diets in order to have a healthy life, in
and
order not to get diabetes. But when we get it, what do we do? Please continue, Maxwell. Yeah, please continue.
okay, yeah. Thank you very much. So, as I was saying, I believe there will be a time for um, questions, and then I would. So, let me quickly get to that. So, I was saying that plant source foods are the best in managing diabetes. However, there are exceptions in the types and then the amount you put into your body. So all these would have to be taken into consideration. So I would say that for that you would have to discuss with your health professional so that a well planned one can be made for you. But the best, I always say, would be the plant sources. And then there are also other sources from the animal um, feeds that we have that would help. But I wouldn't speak about specific foods just because, as I said last week, we live in different geographic locations. So you look around, make the search, and then when you come across the nuts, the seeds, the grains, the vegetables, the leaves we have, the flowers that are all edible. You make use of them. You make use of them. Um, only having to put a stop to any of them when you react to that kind of food. So that is what I would say, that you would have to take into consideration the varieties of plant sources of food you have around you. Then when it gets to the animal type, you make sure you stay away from those that have the high quantity of the negative or the debilitating type of cholesterol. You stay away from those. So those are the um, categories I would give. And then you would have to be very mindful of your way of life in terms of activity. If you are a diabetic, you have to know the kind of activity you would engage in, and then for how long you would engage in. That is very, very important because your body rests on the amount of energy it has. So you have to be very mindful, and then you take critical look at the type of activity you are engaging in, so that that energy that you would have to maintain in your system would be there. You have to be mindful of that. You have to abstain from um, substances that bring a lot of harm to the human system. Most importantly, substances that harm your blood vessels. You have to be very, very mindful that you stay away from such substances. Alcohol consumption, smoking, um, um, those synthetic chemicals that come along with processed foods, all those you have to be very mindful. So you would have to be reading the um the notes on the food you purchase. You have to be reading to make out the differences in all these. I believe you have
Thank you so much, Brother Maxwell, for how far you have brought us. Indeed, today is a day that we are discussing diabetes, and what you have so far given us indicate that when we live longer, uh, that depends on what we take in as well. Though it can be hereditary, but when we look after ourselves well, when we choose the right food, the mostly you emphasize on plant-based um, foods. However, we cannot only live on that because some of us cannot be vegetarians. So we have to know how to choose our meals in order to have a healthy diet, a balanced diet that will contribute to our healthy lifestyle and that will also maintain our cells if we have diabetes. If we haven't got it, we have still a chance aware that we can prevent and protect ourselves from getting it. But how do we do this? By watching our lifestyle because lifestyle contributes major part to diabetes if it's not hereditary. How can this be done? This can be done by watching ourselves very well. As I told you, sometimes you want something sweet, but when you are taking the sweets, think about the implications of it. What will bring it will bring tomorrow that will be a chronic condition that you wouldn't know what to do, but rather to live on medication until the end of your life. As Mr. Owusu, George Owusu is asking a question at this time, he says, "How long can a person live on diabetes?" Please, once you get diabetes, it's a chronic, as we are saying. Chronic condition, you can live on it until whenever God calls you. But there is always a way that you can maintain yourself that will reduce the complications that you will encounter. How can you do this? By maintaining a healthy lifestyle, by choosing the right diet for yourself, by not eating too much to the extent that your body cannot even digest. Sometimes we overeat. Look at what you are eating, little by little. Get all the diets, balance your diet a bit from each group, then that will make you a whole. Exercise your body, prevent yourself from intake of alcohol. Fine, you might be having alcohol. No one is telling you not to take it at all. Fine, you can have it, but the amount, is it a little bit? But sometimes you say, I will take a little today, then the little, then you increase the amount tomorrow. The next day you increase it. Before you realize, your alcohol intake is over, what should I say, over the amount that you thought you were going to have, either weekly, daily, or monthly. And then you'll be dependent on alcohol, which would then contribute to diabetes. So let us watch ourselves. Smoking also contributes to diabetes. Brother Maxwell, one of our brother is asking, how long can a person live on diabetes? And I'm saying that, as we are saying, it's a chronic condition. So once you get it, you might either have it forever until whenever God calls you, or if you change your lifestyle, it can reduce the complications that you are having. I know some people that have been on medication that have been able to balance their lifestyle to a certain point, that at a point they are being taken off the medicine and then living on diet. So then if you are very watchful of your diet, it can really help you. So diet is very important in diabetes. What do you take the sugar? It could be hyper or hypo, depending on which level that you belong to. Are you eating too much or you are eating less? When you get diabetes, there's one thing that you have to know, that you have to know the amount of food that will be enough for your body. Because if you eat too much of it, you get hyperglycemia, and if you eat less, you get hypo. But how can you maintain a healthy diet within your diabetic pathway? By knowing the amount of calories that you take in. So Mr. Owusu Ansah made mention that whatever you eat, whatever you buy, have time to read on the label or the ingredients so that you know what you are eating, and also lower the amount of processed foods that you take in, and that will also be able to contribute to a healthy lifestyle. Do you have any additional contribution to what Mr. George Owusu Bekwin is asking us this afternoon, please?
Okay, so that's all that you've said, though it is seen as a chronic condition. Any individual who sticks to the regimen, most especially in the lifestyle modification, tends to live longer, because the sugar, it's mostly kept in check. So that is it. If you take a good look at the lifestyle modification, sticking to all the plants attached to your treatment regimen, you can live long. Yeah, you can live long, because it will always be kept in check. Your sugar level will always be kept in check. So
Thank you so much, Mr. Maxwell, and thank you to our listeners and our viewers for spending your time with us this afternoon, for how far you have brought us and how far the Lord has brought all of us to this point. At this moment, I would like to acknowledge Mr. George Owusu Bekwin, Sister Tai, Sister Pabi is watching us, Sister Janet is watching us, and Matron is also watching us. I don't want to mention your name, but you know yourself, because she sent me a message that she's watching us this afternoon. Thank you so much. And everyone who is watching us this afternoon, you didn't not identify yourself by sending us a comment, so I wouldn't know who is watching us. But whoever is watching us, we say thank you so much for how far you have been with us. Papa Nico is watching us from Amsterdam. Whoever is watching us from Amsterdam, we say thank you for watching us this afternoon. And those from Hamburg, we say thank you for watching us all over the world, from Ghana, from UK, from Nigeria, from USA, wherever you are. We say thank you so much for spending your time with us this afternoon, Mr. Owusu Ansah, as we bring our programs to the end. What recommendation do you have for our listeners? Some of us who have diabetes and some of us who have not had it. What advice would you give us? Thank you.
Okay, so what I would put out again is that kindly let your your healthcare practitioner or healthcare personnel know the problems you have, so that plans can be made about that. And then whenever there's a plan to help in the management of a particular health condition, kindly stick to it. Kindly stick to it, and then report whatever abnormalities you find from the plan that was given to you. And then, as I always say, we as an organism, the human being as an organism, gets its revitalizing forces, the nutrients and everything from the soil. And so it is the plant that takes it up and brings it to us. So that would be the first line that I would talk to you about. And then the others, you'd have to be very mindful that you take those that do not have the high amount of the harming cholesterol. You kindly be very mindful of that, because um, the work that the body does mostly is centered on the energy it receives. So if you look at this, or you have this in mind, then you would be able to know how to go about your diet. So kindly stick to a very healthful diet. Thank you.
Thank you so much. One thing that I missed that from Mr. Owusu, at what age is at risk of developing diabetes, please?
Oh, okay. Okay. The type one, those that rely mostly on insulin, that's they mostly discover it at early ages, say from 11, 12, in their teens, thereabout. And the type two, those that are managed on the medications, those come about in later life of the individual, say 30 and above. But notwithstanding, whatever happens that would cause a problem to the functioning of the pancreas or the production of the insulin, that hormone, whatever happens that brings about a defect in that functioning, can um, bring about this condition. So all we would be advocating is that you keep a regular check of your blood sugar, and when you find out that it is in the optimal range. You see, when an individual has not taken in diet and is not doing any excessive activity, the regular, or let me say the optimal sugar level should range from 4 to 8 millimole per liter. That for that the health people do understand. However, when it's regularly checked, you would know how to go about things in the day. So that is what I would say. The type one comes about early in life, and then the type two also goes late in life, and then the gestational one is related to pregnancy. So that is what I would say about the age range. Thank you.
Thank you so much, Sister Pabitra says. Thank you for sharing the knowledge. Thank you, Sister Pabi, for spending your time with us all the time. Please keep watching us. Right after Easter, there will be something nice for you. It could be you, it could be someone. So don't forget to watch us every Sunday between 3 to 4 UK time, and then 2 to 3 Ghana time. And then we can compare it to the other times depending on where you are living in this world. Thank you for your time and everything. Today we have discussed diabetes and how we can live a diet that will be able to control diabetes if we have it. But if we haven't got it, how we can live a healthy lifestyle that diet will also contribute for us to prevent ourselves from getting diabetes, because when you get it, it's a chronic. It becomes chronic. It's hard. But to manage it depend on your activities, your lifestyle, and what you take in daily. However, monitoring your diabetic uh, control will be able to give you the opportunity of what you can choose. Monitoring your blood sugar level will be able to identify the type of medication that the doctors will also be able to help with, either to increase it or to decrease it, depends on us as individuals. Let's live a healthy life that will prevent us from getting ourselves into chronic conditions that will end our life short. Rather, we will live a healthy life that will prolong our life, so that we can enjoy the benefit of what we have toiled for, and to look after our children and great grandchildren and our generations to come. Thank you for spending your time with us. And my guest is no other person than Mr. Maxwell Owusu Ansah. Thank you so much for spending your time with us, Mr. Maxwell. And I know whenever we knock at your doorstep, you will always open us to come through, so that you'll be able to bring us the good news that our listeners and our viewers will also benefit from us, as well as it will increase our knowledge as healthcare professionals as well. And my name is no other person than Hanna Bimah, the only one from Richmond Media. Thank you for watching us.